But first tonight, there is a renewed focus on the debilitating effects of long COVID today as the federal government commits a further $50 million towards research into the disease. The announcement follows a parliamentary inquiry into the condition which has recommended, among other things, improving long COVID data collection, reviewing antiviral eligibility, improving training for GPs to treat long COVID, as well as funding long COVID clinics at public hospitals. The announcement has been welcomed by long COVID sufferers, including Ashley Quadrio. She contracted the virus in March and has told the Drum's Bethan Smolenick that life just hasn't been the same since.
It's impacted me in a really big way in every area of my life. The symptoms that I've been dealing with since originally contracting COVID are primarily fatigue, which fluctuates depending on how much I rest or how much I do. So I get brain fog, can forget, as I'm doing now, what it is that I was saying. I don't want to say it's ruined my life because I'm determined that long COVID won't get the better of me. But yeah, in a sense it kind of has. I was really fit, very active socially and in my church, and a core part of my role is litigation, instructing in matters before a court or a tribunal. Because of the fatigue, I need to be able to have regular rest breaks. I am currently working a reduced load. In terms of exercise, the current prescription is 4 days a week. I can go for a gentle walk. I don't go out as much. I work from home and go into the office 1 day a week where I can. So I got COVID in March. I think if there was more of a focus then on long COVID, that I could have got a diagnosis sooner and that maybe I could have been taking it easier sooner.
Lisa, it seems that there are some typical symptoms that are being associated with long COVID, but there's still lots of questions as to how we should define this and how it should ultimately be treated and what treatments are appropriate and so on. What's the latest thinking? What's your view on what this is and how we're managing it or yet to grapple with it?
Yeah, we're not managing it. One of the things that really worries me is that people seem to think that we're in a post-COVID world, and that is abundantly untrue. More than 1 in 10 people who have had COVID, and we know the vast majority of all Australians have had COVID, will end up with this thing called long COVID, and that's the people that we know about. And long COVID can manifest in a variety of different ways, and I think a lot of it depends on, your residual health, your gender, your age, your circumstances, and we know that long COVID is hitting ordinarily well people very, very hard. And what is concerning is the diagnostic trail. Often people can't get support from the government, such as sickness benefits, until they have a diagnosis, and it's really tricky to go off and diagnose because we don't have a clear pattern of symptomatology. We don't have a pattern of what we can say, this is long COVID, so therefore you're eligible for these particular things. We know that there are over 4,000 people a week at the moment being diagnosed with COVID. And we know that that's the tip of a tail because most people are not actually reporting it, or we know that most people aren't getting treatment for it. So if you start looking at those kinds of numbers, then you know that 10% of those people just last week who have been identified as having COVID, at least 400 of those people will end up with not resolving symptoms 3 months after infection.
I wonder as well, it seems the data that is such as is at this stage suggests that more women than men are experiencing long COVID symptoms, while more men may be having more severe COVID, possibly for lifestyle reasons in the outset, but the longer term symptoms. Is there a danger that, as with so many female illnesses, ones that affect women disproportionately, menopausal symptoms, post-viral fatigue, things related to pregnancy and so on.
Pain.
Pain, just general pain and so on, that this will kind of be seen as, oh, well, it's just, after viruses, these things happen, but, get back into the swing of things, it's maybe a little bit up in your head.
Medical gaslighting?
Yeah.
Is that what you're asking me the question about?
A woman's lot to suffer.
Yeah, exactly. And it's really very, very unkind. You know, women are 51% of the population after all, and many of our general practitioners are women. So I think we need to get real about what this means, and that the economy is having such a significant hit. It was something like $5.7 billion per year of lost productivity. You know, that's meaningful. That's a lot of our economy, and we've got a lot of people that are out of work. In my portfolio at the University of Sydney, I have on any given week at least 2 of my executive senior leadership team out with COVID or out with something that looks like long
That's a team
COVID.
about how large?
My executive is 10.
Right, so 20% absentee due to COVID.
At the moment.
At the moment.
Yeah,
And
which is shocking.
I keep thinking, because we talk a lot about the workforce, but I also keep thinking about the unpaid workforce, particularly you're a mother at home with small children and you've got long COVID. What on earth do you do? Because kids don't step
don't
backwards.
stop.
They don't stop. They don't say, oh, mum's not well.
Yeah.
That must be just ghastly. So it's a real worry in terms of knock-on effects for the family of the person who's suffering, and the worry and the idea too, when you've got anything that isn't properly understood, and also where you don't know how long is.
Right.
The level of anxiety that must go along with, am I going to be like this
For the
forever?
rest of my life. And what's that going to do on my ability to pay my rent, pay my mortgage, look after my
kids.
family, look after my, you know,
So you can
if
be
I've
dealing
got
with
other
anxiety and
responsibilities.
depression on top of long
Absolutely.
COVID.
And so
quite
people
easily.
march into
Uncertainty.
poverty real fast. They march into poverty. You know, often people are just a couple of pay packets or a few months away from losing their ability to pay the rent or to pay the mortgage, and that has dire consequences on us as society. You know, it increases poverty in your locale, and of course you then have to say, are we the sort of society that is really ready for this abundance of poor people or people who can't afford to pay their bills or people who can't afford to pay their rent because they've had an illness that is of no fault of their own. It's COVID.
Annie, what can you tell us about your experience? Because I know you've had some lingering symptoms that may well be long COVID, but it's sort of hard to, as I understand it, get a kind of a clear diagnosis on that.
Yes, I got COVID in May last year, so it's been almost a year and I'm left with heart palpitations. They used to be daily, and my doctor said that worst case scenario I would need a pacemaker, so I thought I'm so young to be thinking about this, but the more I talked about it, I actually do have a friend who has had a pacemaker and it happened after COVID, so I didn't have any of these symptoms in the past and I couldn't find any information about it. The most useful thing I found was at a bookstore. There seemed to be a book about long COVID. It was the only one at the store at the time. I flicked the index, looked under P for palpitations, and it said that they can be a symptom but they're not harmful, but they are so annoying. So I still am left with it and the doctors are like, there's nothing more we can do. So I feel lucky that it's not the fatigue on top of that and everything, but I did feel like quite helpless, as well as you almost feel like you can't question it because I did get the vaccine and that you'd be lumped in the category of anti-vaxxers if you're sceptical about whether or not either getting COVID or getting the vaccine did lead to me having these heart palpitations as a long-term impact on my life.
So, you know, Lisa, with so much of this is still so new, and we're living through this science experiment where we're discovering what this illness is as it continues to affect us, and also sometimes the side effects that can come with boosters and vaccines as well. And so, are there good sources of information now where people can? I mean, obviously, seeing your GP and if you can get an appointment is a good first step.
Yeah, but you've also got the COVID hotline, which is still functioning, and as it should, because we're still in COVID. But these 9 recommendations that have come out of this report, you know, Australia, if we were to take on all of those recommendations, I think would not only save lives, but it would save the ability of many, many people in our society to function in the way that they feel they should be functioning, be able to get back to work and be able to do the things that they cherish about their lifestyle. You know, ultimately, we have to bite the bullet and say we're still in COVID. We still need to practice things like hand hygiene. Like, for example, how many people have gone to the supermarket or into a shopping mall and they've still got the little hand hygiene stations, but they're empty.
They're empty.
And have been empty.
Yeah.
I mean, are we not taking this seriously? How many people
not
will hop
taking
on a bus and whack on a mask? You know, how many people are doing those sorts of basic... How many people are coming to work and they're sneezing and coughing and, you know, carrying on all
How
over
many
each
people
other?
sit behind you on the plane? I seem to
Yep.
pick the guy
And
who's coughing
that's
up
right.
a lung on the plane every
That's
single
right.
time.
He always sits behind me as well.
Yeah.
It's
So,
the
Gus,
same
do you
guy.
reckon from hearing all of this that we need to shift our thinking a little bit to these preventative measures aren't about preventing COVID per se, but as much about preventing long COVID, and that we should be seeing them as kind of almost separate, though obviously clearly very highly related illnesses, and that if we don't want to have up to 20% of the population suffering 6 months, 12 months, 18 months of debilitating illness, maybe we need to be refilling those sanitizer dispensers and masking up again, as annoying as it might be.
Yeah, I'd love to take COVID back out of the culture war. You know, somehow it became if you still believe in COVID, you're a kind of a raving
You're a bit of a wowser if you wear a
progressive
mask these
wowser.
days.
Sort of a wimp or something.
You know, I love the Japanese culture where, if, you know, before COVID, if you had a sniffle and you're riding the train, you'd be wearing a face mask. My son did a student exchange over there, and I asked him about, you know, are they worried about the environment? He said, no, they've probably got a sniffle. They're doing what's the right thing for their members of their community. So how do we get back to the stage where we are interested or care about those around us, whether they have long COVID or whether we just want to prevent them getting COVID? You know, my mum's in her late 80s, and you know, we want to do everything we can to prevent her getting COVID. So how do we get it back out of the culture wars and just make it something that we as Australians do for each other? If we've got a bit of a sniffle, we're getting on the train or the plane, let's put a mask on, it doesn't hurt.
But that also doesn't, Gus, go to the other side of the equation, which is you're wanting to protect your mum or the mental health of your children who've been denied an adolescence or the experience of going to university or, you know, being a teenager or whatever, while also not endangering their health long term. It's an incredibly difficult calibration for all of us to make, particularly if we're not getting really great messaging from government or public health officials.
I think there's and you know, not to diminish what Annie and others are going through with clinical long COVID, but I think there's an epidemic of mental health issues coming. You know, we've got a young generation who, you know, have missed a number of the rites of passage, a number of the things that you did to mature and to test your boundaries and to grow. So we haven't seen the end of this, you know, as a community, and the way we respond to all of this is really important. So I think, you know, let's get it away from being something that we argue about and just think practically. You know, with my background, I always think it was 100 years since the, you know, what we call the Spanish flu, till this one. What if it's not 100 years to the next one? How can we learn from this? How can we put in place, you know, measures and social responses and behaviours that mean that whatever comes next is reduced and diminished? So there's lots of layers to this, and I'd love us to see just have us sensible conversations and do what's right.
Yeah, I can see you nodding there, Annie. What would you say in terms of those lessons and also your confidence in kind of mankind's ability to learn those lessons if we are facing another pandemic sooner rather than later?
Yeah, I 100% agree with Gus there around this is going to set a precedent for how we treat future pandemics and how are we going to learn from it and make sure that the people who haven't recovered aren't falling behind. So, yeah, I would agree 100%.
And you want to add something, John?
Yeah, well, I think one of the things we need to worry about too has been, as part of this culture war thing, where it's been sort of pitted the economy against health, as if those two things are somehow opposites or divisible, which is weird. That, you know, the misinformation that comes out. I've had people tell me masks don't make any difference. You shouldn't wear them. They don't help. And I go back and find the research and give it to them on social media, and it has no impact on them at all. And this is the problem. We've got now a situation where people, and this is the problem with the truthiness of the Donald Trumps of this world and Fox News and all of that, is that people end up with not knowing what the truth is and what isn't the truth. And so governments can send messages, that's important. But in fact, so many people no longer listen to the facts.
And Jane, we're going to talk about defence review later, but I think the single biggest threat to democracy is this kind of misinformation, this polarisation of our community, this determination to pull us apart. And unless we can work out how we're going to do that, I loved the way the Electoral Commission, for example, responded during the election. Very small scale, but went after disinformation. I think we're going to have to, as a community, work out, you know, how we're going to do that.
And we've seen Dr. Fauci and we've seen medical people talking about the disinformation, but then they get abused, vilified and demonised.
Absolutely,
by...
and this is part of the issue, is that people say, well, I've done my own research and I have found that injecting bleach is a good thing. Don't do
I've
that.
talked to 3 people on the internet.
But
I know.
That's right. But, you know, the science speaks very loudly. And, I mean, people, if they want to have a reasonably reliable source, you know, go to the health department, ring up the hotline, go onto websites like AusSage. You know, there are a number of these groups around that just call it for what it is. It's apolitical and it's all about society being well and well prepared to look after itself, because ultimately we cannot expect others to look after us. We really have to be very, very clear about our own protection, and simple things like hand hygiene, masks, distancing, ventilation, and remaining away from others when you crook, and be vaccinated and up to date, and get the flu vax now. We're about to go into winter, so please everyone do that. These are things that we can do. We've got agency over that, we have control over that, and it will be better for us all in the long run.
Good advice. Thank you for it. Now, as Australian culture slumbered somewhat through the post-war